Hi and welcome to this short video on subcuticular closure. Subcuticular closure is the term used to describe the closure of a wound using a stitch that's completely buried under the skin so that the patient and you can't see it at the end. It's the most commonly used technique in elective surgery where people come in for planned operations and we make incisions with scalpels so the incision is neat and narrow and doesn't leave any crosshatch scarring that you might see if you used an interrupted technique. You'll notice that I'm using a monofilament suture, and because it's buried under the skin, this is a suture that's absorbable and therefore doesn't need to be removed. So on this example, we're going to start by using this wound here, which is a very narrow wound, like a surgical wound, with minimal dead space, and we're going to start in the corner here because I'm right-handed. If you were left-handed, you might want to stitch from the other side of the patient and start on this corner here, but we'll start here to demonstrate. The first bit of a subcuticular closure is to get this suture locked into the apex of the wound, otherwise it will pull through and your wound will separate. And there's a number of different ways to do that, but since we've shown already the deep dermal stitching, that's the technique that we'll use. So we're starting in the apex, we're going deep to superficial, and then we're returning superficial to deep on the other side. And then we're going to tie our surgeon's knot. So a double throw in one direction, lay that down gently, a single throw in the other direction, single throw in that direction. And then this end here, that's the problematic end, we're going to trim nice and short, like that, and then everything will be buried to start with. So the first step is to get this suture into the apex of the wound. So we're going to come deep under our knot and we're going to come up right in the apex of the wound. Take our time to get it right. There we go. So now our suture is ready to start. And what we're trying to achieve is sutures running under the skin that are nicely square, running like this, not visible at all, not catching the skin, so that you don't get what I call a happy face, sad face appearance. So we start by stitching on one side, pull that through, and then go to the other side, exactly opposite this limb. So that's where we're going to go. In reality, what people who are learning end up doing is going forward, and that gives a really significant happy face, sad face appearance of the wound, and it will tend to separate. For that reason, in reality, most people will go slightly back on themselves actually. As you begin to learn to stitch, you realise that what you learn in the classroom doesn't necessarily apply in reality. You also want to fish any hairs out like that. Again, I'm going either directly across or slightly backwards on where I've been before. And you can see that I'm just pulling it through so I can see my stitch. You don't need to pull it through all the way. And you can see I'm gradually setting up a number of different bites. And on this one, I'm going to just show you how it closes. So holding the stitch, holding down the skin edge, if I pull on that now, you can see that it closes nicely. So you can see the skin's coming nicely together. Just working my way along. So now I want to show you what we call a buttonhole in surgery. A buttonhole is when you sometimes accidentally come out of the skin. You go in nicely here and you accidentally catch a bit of the skin there and you come through there. And if you pull that through, what will happen is sometimes you don't spot it. And you come through this way. And as you pull that, you can see the patient's going to end up with a dimple. You can see there, just as the stitch is pulling in, there's a small dimple. They're not going to like that very much. So we try and avoid buttonholing the skin, and that's the term that we use in theatre to describe that. So now we're going to end our subcuticular suture. I think we've gone on long enough down this wound. And the way that we do that is, imagine I'm coming to the apex of the stitch now. So we're going to call the apex about here. We're going to end the wound here. So my last bite will come exactly as before into the apex, okay? Now I'm going to lay that suture down nice and gently, just so I can see it. And then I'm going to start superficial, and I'm going to come out deep in the wound and leave the needle like this. So now I've got a deep limb, this one, and I've got an apex limb, which is this one here, deep, apex, and another one. And what we're going to do here is called an Aberdeen knot. So in an Aberdeen knot, it's probably easier to get rid of your forceps when you're doing it. You're separating the two limbs, you're fixing the tissues, you're often using the back of your hand, and you're holding the loose end in your right hand. So we've got our deep suture, our apex suture, and our other suture. We pass the deep suture through our two here, and we pull on the bottom limb, and it closes. We repeat the procedure again. Grab that one, pull it through, pull on the bottom limb, grab it again, pull on the bottom limb, and then pass the whole suture, including the needle, through the loop, and then pull on that limb, and that will slide down and it will not lock the knot. If it doesn't quite lock, sometimes you can just gently push down on the knot to lock it. The final step of a subcuticular closure is burying that knot. You can see that if I pull on that, there's the knot. So to bury it, I just come very close to the knot, dive deep into the wound, making sure there's no nerves or important things there, come out way away from the wound like that. I then pull that stitch through, and you can see that as I get towards the end of that, the knot, there it goes, will disappear and flip under the wound. We can then simply cut that flush with the skin, and that concludes our subcuticular closure. Normally you don't need any additional support for the wound. Occasionally some people will use steri strips. You definitely don't need skin glue, but you can use that as a dressing. I hope that video has been helpful for you in learning about subcuticular closure.